Ladies, listen up, because today I'm going to talk to you about something and ask you to think about a few things that might feel a little bit embarrassing. So question number one, are you afraid to exercise because you leak when you jump or run or bend? Are you wearing only dark clothes to the gym or out on a jog because you're afraid that some spots might show up if you wear lighter clothes? Number two, are you afraid to be intimate because with any leakage issues, you think that you aren't as fresh as you should be, or that you're afraid you might leak during sex? Are you avoiding intimacy because it doesn't feel right, feels loose or dry or uncomfortable? I'm a gynecologist for 30 plus years. You know, a lot of women have concerns, but they're afraid to ask about them. They're afraid to mention them to their doctor. They're embarrassed. They've been told that's just what it's like after you have babies or once your hormones start to shift. A lot of time the damage down there starts with pregnancy and childbirth because of the weight on the pelvic floor and then having a baby. But initially, perhaps the tissues are young enough that they can compensate, but then once you're in your mid 40s, things start to change. And now all of a sudden the leakage is more. Even with the pelvic floor relaxing, you can put strain on the nerves that supply the bladder, and then you get an urgency feeling, which means that you feel like you have to go when there's not much in your bladder. And when you gotta go, you gotta go, you gotta run. And the urge to go to the bathroom is disproportionate to the amount that comes out. If you have to look any store you go into to see where the bathrooms are because you might have to go, then that's not normal. Is it common? Yes. Is it normal? No. So now I'm so excited because we now have things we can offer to help with these things other than surgery. Here's a fun, quote unquote, fun fact. Back when I was practicing OBGYN, before I opened my functional medicine practice, when I would talk to women about any of these issues and they would talk about either a weak pelvic floor, urinary incontinence, leakage, or the urge incontinence, I would, as I was doing their exam right after the pap smear, when the doctor feels for your uterus and ovaries, I would say, okay, do a Kegel exercise for me. And you know what that is? I'm sure you've heard of it. You're supposed to squeeze your pelvic floor muscles so that they tighten. And I was actually feeling the pelvic floor muscles to see if these women could identify the muscle and cause a contraction. Oh, at least 50% of the women couldn't even move the muscles. It's kind of like if I told you to wiggle your ears, but you don't know how to wiggle your ears, nothing happens. So a lot of times women would just squeeze their butt muscles together, their glutes, and think that was a Kegel, and it's not. And then the women who would do it, we would grade the strength. You know, if you couldn't even identify the muscle, that's called a 0 out of 4. And a 4 out of 4 is a nice, strong, firm contraction. Very few women had a 4 out of 4. Most of them were 1 to 2 out of 4. So strengthening the pelvic floor is super important. And there's no time like the present to start that. It's never too late. Muscles respond to work. But if you don't know how to identify the muscles, then me telling you to go do Kegel exercises does no good. So there is a machine. We purchased this and we have it in our practice now. And it helps you do the perfect Kegel. And you can come in once a week to every 2 weeks for a 30-minute session of perfect Kegel exercises. We've had women report significant improvements, life-changing improvements, bending over, jogging without worrying about leaking. So strengthening the pelvic floor will help with that significantly. It can help with the urge incontinence and the stress incontinence. And guess what? It also helps with sexual function, because during climax or orgasm, the pelvic floor contracts. And if it's super weak, then you don't. It can improve sexual response. But what about the dryness issue? Oh my gosh, I've had so many women over the years talk to me about this. And I would ask every woman in perimenopause and menopause and beyond what was going on. And initially, here's what I would hear, an organized sequence of events. First year, no problems. Second year, a little bit of problems, but we just now use the lubricant during relations where we didn't used to have to. By the third or fourth year, please for help. This hurts. You're avoiding intercourse. You feel bad for your husband, but what's the point if it hurts? Now, hormone replacement therapy can help with that, but so can improving elasticity and collagen and the secretory cells. So we use a radio frequency device that helps significantly to improve the ability to make these secretions to have more moisture and elasticity. We had a gal in the practice with breast cancer and not wanting hormone replacement therapy for that reason. And she was menopausal at a young age because of her treatment for breast cancer. And when I asked her about it, she said, I have dryness and it's not comfortable. It's not like it used to be. And she's only 48. So we brought her in and we did. After one procedure, she said she noticed a difference. She wasn't needing the lubrication. She noticed a difference when she was having sex with her husband. And this was without surgery. And then with the urinary incontinence, tightening the pelvic floor is helpful. Well, super helpful, mandatory. But then increasing collagen and elasticity in the vagina is possible. We use a radio frequency device that also does microneedling down there. Don't worry, we numb you up first, so it's not painful. And several treatments, 4 weeks apart, life-changing for women who have dryness, laxity, or even too tight because not enough elasticity. These treatments improve your health down there so that you can have confidence with exercise, confidence with intimacy. That's what it's all about. Once we get your energy back and you want to start having sex again, because we know that women who are exhausted avoid sex for other reasons because they're just too dang tired. But once we get your energy back and you want to have that intimacy, it's important in relationships. Don't let these problems prevent you from doing it. There's treatments available. If you're in the Chicagoland area, we welcome a call from you. We can hook you up with one of our nurse practitioners to do a complimentary consultation to see if you're a candidate for these devices and these therapies. Don't suffer in silence. And if you don't live in the area, bring it up to your doctor and ask what can be done. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. I care about all aspects of your health, the ability to exercise, the ability to be intimate with your partner without problems. Send this to someone who needs to hear it.